And also the ADHD is now, I mean, everybody, it seems like almost everybody is diagnosed with that. Do you
Oh,
think
yeah.
that mold exposure toxicity, does it actually translate into those other conditions as well?
Well, I have seen it. I have seen some people with pretty severe ADHD and or anxiety disorders that really have pretty high levels of mycotoxins and the mold has affected them in a very detrimental way. When you have that mold affecting them in that detrimental way, remember, that inflammation is going to cause an issue where your serotonin, your dopamine, your GABA, they can't dock to the receptor sites appropriately. Why? Because they're going to be blocked by that mycotoxin.
You've tried everything. You've changed your diet, you've detoxed, you've even moved homes, and yet you still feel sick. Headaches, brain fog, fatigue that no one can explain. What if it's not you? What if it's your environment? Welcome to Mold, Mycotoxins, and More. I'm John Bodie. Each week, I sit down with experts uncovering how mold, mycotoxins, and environmental exposures affect your health and what real recovery looks like. Let's get into today's conversation. The information provided on the Mold Pros podcast is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. Listening to the podcast does not create a doctor-patient or professional-client relationship between you and the podcast host, guest, or the Mold Pros. The content shared should not be used as a substitute for professional medical advice, diagnosis, or treatment. And always seek the medical advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition, potential mold exposure, or health concerns. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. And while we strive to provide accurate and up-to-date information, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability of all the information discussed. And guest experience and outcomes discussed on this podcast are individual cases and should not be considered typical results. Your situation may differ significantly. As always, if you think you have a medical emergency, call your doctor or 911 immediately. By listening to the Mold Pros podcast, you acknowledge that you understood this disclosure. Welcome back to Mold, Mycotoxins, and More. I'm your host, John Bodie, co-founder of the Mold Pros. On this podcast, we explore the real-world impacts of environmental exposure, not just in buildings, but in the human body. And today we have a very special guest, Dr. Gordon Crozier. He is a board-certified physician, medical director of the Crozier Clinic, and has over 30 years of clinical experience. He's really known for his work in integrative and root cause medicine, specializing in complex chronic conditions like mold toxicity and Lyme disease and environmental illness. His approach combines advanced diagnostics, genetic testing, and a personalized treatment protocol to uncover what really traditional medicine oftentimes misses. He's also a nationally recognized speaker, an educator, training physicians across the country on cutting-edge therapies and chronic illness. Dr. Crozier, welcome to the show. Really glad to have you.
Well, thank you. It's good to be here. And I want to thank you for what you did because I can remember, I don't remember if it was 12 or 15 years ago, but it was a long time ago that when we would send people to you for help to clean their homes up, because that's the first part of what we have to do in mold illness is clean that home up. You did it. And your homes and the people that were treated, that you had their homes, they came back and they did phenomenal with treatment modalities where a lot of the other ones did not. So you really gave the true ability to clean homes in a proper way. And so I'm so appreciative to all that you've done.
Thank you very much. We have known each other for many, many years. I don't know if it's been 12 or 15. It's been around that time frame. You know, our families, we've shared meals together. I remember sitting around your dining room with I think it was your wife's extended family. We've had some great conversations and really appreciate the relationship that we've had. If you don't mind, not to put you on the spot, but I happen to know some of your backstory, and I know that you yourself had a personal journey with chronic illness. And so, if you don't mind, if you want to share a little bit about that, and maybe did that shape any way your approach and how you handle patients that have environmental health conditions?
It sure did. And it still does to this day. And because nobody knew really what it was back then. You know, I mean, it was kind of an enigma. way back then. So I was actually sick as a child too. I was sick. I had Crohn's disease when I was very young. And then, with that, I got through that and I was kind of going through life until I was working. I was working at a university, a major university. The OR I worked at, I didn't realize the OR that I worked at every single morning teaching the residents was full of mold. And I had no clue.
Yeah.
And then we had a brand new home, but our home had had a leak in it and it wasn't, done properly. And we had leaks behind the walls. Our house was, even though it was brand new, was full of mold. So I had both of those things. I became so severely ill. I started passing out in surgery. They put me on medical disability. Nobody could figure out what was going on with me. I had to do the due diligence to really figure out myself what was happening. And it took a long time. On top of the mold, nobody ever did a traditional Western blot. I was positive on a traditional Western blot for Lyme disease. So I had mold and Lyme, and I
Oh.
call it the dreaded duo. That's what I always call it here in my practice. Well, you have the dreaded duo. so so I really had to weave myself out of where I was at. And that's how I kind of understand the pain syndromes from toxin exposure, and not just the pain syndromes, but also the neurological insult that happens on you neurologically. And then I've treated so many people because that's primarily what I do here is do treat a lot of neurological illness secondary to toxin exposures. And so that I really had to work my way out, and I did eventually find. So what I did is I had to read a lot of literature, and most of it wasn't here from America at that time. It was actually European literature way back then, and they were kind of ahead of us. Now I think we're ahead of them now, but they were ahead of us at that point. And then we had other people that came about that started treating mold, and you could kind of read a little bit more and kind of gain some insight from other practitioners that were doing it, but there were hardly anybody doing it way back then. There was very few people. And even 15 years ago, there was hardly anybody that we had doing it. So,
You've cleaned, repainted, and replaced filters, and still, you're not getting better. Headache, fatigue, brain fog, the doctors can't explain it, but your environment can. At the Mold Pros, we specialize in uncovering what's hidden in plain sight. Our environmental testing looks beyond surface mold, identifying bacteria, volatile organic compounds, and even mycotoxins in the air that you breathe. Then we correlate those results with your clinical data, showing how your space may be affecting your health. Next, we use our patented remediation process to safely remove toxins, restore balance, and prevent them from returning. It's more than just a cleanup. It's a science-based system designed to help your body heal by healing the environment first. If you're ready to breathe freely again, visit themoldpros.com and schedule your free consultation. Because wellness doesn't start in the doctor's office. It starts where you live. Yeah, I think that's the first conference I think that I went to, and we're going on 20 years of helping folks with environmental illness. I don't
yeah,
think I don't think there was like 100 healthcare providers in that room. And now, we can go
no,
to conferences and there'll be over 1,000
yeah.
plus, right? And so the awareness has certainly cranked up. But I think it's kind of interesting. So here you are, you're a medical doctor, an instructor, and you're getting exposed and you can't figure it out.
Yeah.
We hear oftentimes with some of our clients that, listen, I know something's just not right. My kids are sick or I'm sick. And, we've been to our family doctor. Or we've even maybe gone to an allergist and they've run some tests. Everything comes back fine, but I still feel terrible.
Yeah.
What, what's your experience? How on earth can well-intentioned, well-informed, well-educated medical practices run these standardized mold tests and still miss mold-related illnesses?
Well, I think they aren't. Number one, they're not looking. And number two, some of them really still don't believe in it. It hasn't been that many years ago. I was reported to the board of medicine from a plastic surgeon that did not believe in mold illness. Did not believe in it. And this is not that. It's just a couple years ago. So now I have a slap on my hand because even the board doesn't really believe in it. But I had all the literature, I had all the scientific facts to back me up, and they said, "Well, we still have to give you a slap on your hand. That's the least we can do, and that's what we have to do." So it's kind of crazy that we're still in that way today, but we still are by a lot of physicians, so they miss it. And then you have people that haven't been properly trained on how to read the labs.
Hmm.
So, you look at specific SEERS or chronic inflammatory response syndrome or labs, you look at those labs, and when you have those labs, a lot of people don't know how to interpret them. And so then they're like, "Oh, what's that mean?" Well, what does it mean if you have a high TGIF beta 1? Oh, wow. Well, that's a lot of inflammation going on right there, right?
Right.
They don't know how to get that. They don't really know how to do it. And there's still a lot of people, even in integrative medicine, regenerative medicine, functional medicine, they don't believe in the urine test to look for mycotoxins in your urine. And I think it's legitimate myself. And, you can there's different platforms that are actually doing it right now. And there's three major ones that I would trust. And, they're good. And I think they really do give you an aspect of what's going on with these mycotoxins. And, that really proves a lot. But what I see also is a lot of people don't understand is that when you have mycotoxins, you also might have heavy metals or other environmental toxins. So you really have to go a little bit farther and look for more environmental toxins. And that's how I got involved with other universities that were doing more with other environmental toxins, and really became friends with a couple of toxicologists here in the US, which there's not very many.
Hmm.
There's only like 1,200 nationwide environmental toxicologists here. So, that are actually true toxicologists. I call myself one, but I don't know really.
There's a couple things there. I think it's worth expounding upon. For a long time, the government has tested our foods, like coffee and peanuts and those for quote unquote acceptable levels of mycotoxins. And
Hmm.
so if the assumption would be vis-a-vis that there are therefore unacceptable levels of mycotoxins, and the
Yeah.
reason for that would have to be, you would think, adverse health effects on those
Yeah.
consuming those food groups. So how on earth could you get your hand slapped uh, for treating that condition that the government tests our foods for? That just doesn't make sense to me at all.
No, it doesn't make sense, but that is our medical system. That's our medical system today. They're trying to, they don't want to have big payouts. Look at some of the numbers, how they've shifted because CLIA, it's a government mandated certification for labs, how
Right.
they've changed some of the parameters of what's allowable in your body versus what it was years ago, back when we first started this. So because we're becoming more toxic all the time, so that just it kind of irritates me. But I think they don't want to pay out, and they don't want to have all these claims and all this litigation, and and insurance companies really don't want to pay for it.
So it's the old follow the money, as my wife always reminds me. If you there's an issue, trace it
Yeah,
back to a dollar sign. Yeah, very good.
I would say I would say it's follow the money.
Yeah, yeah. We started out when you and I first had our relationship together. We have a patented process for actually not only can we identify those environmental toxins, and initially it was primarily mold that we were looking at, and then they got to be where we could test effectively for mold toxins. But our patent is actually removing those toxins from a structure using enzymes and botanicals. But we've grown so much because there's other toxins that we get exposed to. So now, for example, like formaldehydes and these
Mhm.
VOCs, the way we're building new homes today increases that toxic load in the body, and we don't think about that oftentimes.
No.
But we always stress really comprehensive indoor testing to understand what those overall toxins. And we just recently added last year heavy metal toxin testing environmentally as well,
Oh, good.
because of demand from our healthcare providers that we partner with.
Yeah, that's good. I'm glad that you have added that as well. I mean, because all those toxins matter. It really matters on how how you're going to treat the person. But when you know their living environment is full of these toxins, even if they don't show up in the person, you know they're there.
Right.
They're
Exactly.
hidden.
Exactly. And that, just kind of shifting gears on another subject that we get a lot of is a lot of our clients will call in and they have this, well, it's confusion, memory loss. They talk about inability to focus, those sorts of things. And in our industry, we always talk about, chronic fatigue syndrome or sick building syndrome, where, hey,
Mhm.
folks are, they're not feeling well inside their house, and they go on vacation, they feel great, and they come back home, and then they're sick again. And brain fog is something that they always bring up. What's your experience been with brain fog? A lot of folks think that, hey, they're losing it or they're going a little bit crazy. Is there something more, maybe physiologically, that's going on with
Yeah,
brain fog?
it is because these toxins, and I don't care which ones, they all are going to cause neuroinflammation. So you're going to have increased inflammatory response. As that happens, the microglial cells become activated, and they pull more inflammatory cells from your peripheral tissue to your brain neurologically. Well, that induces more of an inflammatory response. If you have any tendency towards Alzheimer's, dementia, Parkinson's, ALS, PLS, you name it, any neurodegenerative disease, if you have a prevalence to that because there's a family history or
Hmm.
maybe just some genetics, which we can look for, that can really preempt those things beginning. But a lot of times it's just what we call brain fog. That's what everybody says. I have brain fog. I don't know why I have brain fog. I can't remember, and that's just from a neuroinflammatory response that we can easily reverse once we get you in a clean building. Number one, you
Right.
got to have a clean living environment. And number two is really in a systematic way removing those toxins, but then replacing what needs to be replaced. Because if you remember, these really like the lipid membranes. So they like the mitochondria, which causes chronic fatigue syndrome. They like those lipid membranes, and the mitochondria in the brain is very essential for neurological health, but also everywhere else in your heart. You can get POTS, you can get arrhythmias, all those things from all these toxins. But we have to remove those toxins, yes, but then we have to replace the phosphatidylcholine, phosphatidylserine, the different lipids that are needed in appropriate amounts. When those are replaced, then you can rebuild that mitochondria and you can help with some of the energy and some of those things. But that's a process and it takes time. People want to get better instantly because we live in
Right.
an instant society, right?
That's
Well,
right.
it doesn't happen like that because who knows how long they were living in that moldy place or working in that moldy place. We don't know. And so that's why, for me, I'm really diligent. I always want you to inspect my home and so but that's why you have to be cognizant of what really happens. And I've had several patients. I had one patient that they said, "Oh, he's so he's schizophrenic, he's really bad. There's no hope for him. You need to just send him off to psych." Well, I do work with psych too, I do have them on hand for me, but a lot of these people, like for him, no, we got him out of his moldy environment and then we started treating him. So as we started treating him, he didn't hear the voices anymore, so the voices stopped in his head, and then he started thinking more appropriately. So it was really diligent that we really looked into that and really did that because I had some people say, "No, you gotta get rid of him. He's too far gone. He's too psych." Well, he's a physician today. So,
Wow.
yeah.
Wow. That's fantastic. I
So
want
it works.
I want to back up just a little bit. We were talking about some of these chronic things, and we've had some folks on where we've delved into dementia. You talked about ALS and that sort of thing. So there's kind of this adage that our genetics pretty much is the gun, but it's our toxic load, environmental exposures that kind of load the chamber, so to speak.
Yeah.
Is that what you're seeing as well with those chronic conditions? And then is brain fog separate from that?
Well, it's a continuum. So you're going to
Okay.
start with brain fog, and you're going to have a plethora of other things that could happen. So yeah, brain, that's kind of where it begins, but then it goes off into other things. Now, you can maybe not even have genetics for dementia or Alzheimer's because we know there's specific genetic traits for those and genes that will predispose you to that. But there's people with those genes that never develop it. How do they never develop it? Well, it's your environment. So a lot of it's going to be our environment, what we eat, how we eat, what we live in, how we exercise, what we do on a daily life. Our daily life really dictates how you're going to express your genes. And we know that. We know that today. And I speak on that a lot. And because you can look at even like Jordan Peterson, he's a big one right now. He had a mold exposure. He's big in psych, and he had a benzo issue. So with benzodiazepines, and he had a sudden withdrawal, but then he had a mold exposure too. And as that mold exposure happened, then he ended up with really bad pain syndromes that is just it's systemic. It's all over your body. And I've treated several patients with it, so I know what it is for those people. The problem with those people is they do tend to commit suicide. So yes, I did have one of my patients. I've only had one. I'm thankful, only one, but I did have one that did commit suicide with that. But you can, there's things we can do to more rapidly help them at this point now. So that's what I like to think on is how can we help you? How can we help alleviate some of these chronic disease states? And I believe we can. So I've been involved with a couple of neurological uh, situations where we can actually have been doing some studies to help to understand this a little bit more. So and I think we need more studies on it because we really have to understand the depth of it because it's extremely complicated.
Oh yeah, for sure. And I think about, you have these issues with you talk about some of the psychiatric conditions that you mentioned before, but stop and think post COVID where we have increased anxiety and depression, especially with a lot of younger folks.
Yeah.
And also the ADHD is now, I mean, everybody, it seems like almost everybody is diagnosed with that. Do you
Oh
think
yeah.
that mold exposure toxicity, does it actually translate into those other conditions as well?
Well, I have seen it. I have seen some people with pretty severe ADHD and or anxiety disorders that really have pretty high levels of mycotoxins and the mold has affected them in a very detrimental way. When you have that mold affecting them in that detrimental way, remember, that inflammation is going to cause an issue where your serotonin, your dopamine, your GABA, they can't dock to the receptor sites appropriately. Why? Because they're going to be blocked by that mycotoxin. So those toxins, and it's always not even just mycotoxins. There's other toxins. And you talked about some of them earlier that you can test for in homes now, which is amazing. And even heavy metals. We're getting to be have a lot of heavy metals. I thought lead was a thing of the past lately. Some of my people, they're
Yeah.
coming up with high lead levels and I'm going like, where's this coming from? And it's kind of strange, but they are. And they're young. These are young people in their teens and 20s. And we really need to take that into effect when we're thinking about these things. Is it just mold or is it mold and other toxins? They usually have more than one thing.
Makes sense. There's a lot of, especially when we start talking about SIRS or chronic inflammatory response syndrome, there's this, and recently, probably the last 4 or 5 years, more discussion around endotoxins, right? And
Mhm.
gram-positive bacteria, et cetera. What's your thought as it relates to environmental illness and exposure to endotoxins? Do you think it's a large contributing factor, or do you think it's less so than what mycotoxin exposure would be?
I think it's still I don't think it's more, okay? But I do think it's a critical point that you need to take into effect that are these endotoxins really causing something more detrimental on top of the mycotoxins? Now, if I do all the things and I'm not really finding any mycotoxins and they have their home inspected and they don't really have any mycotoxins, but then they have something else going on in their home, then you look at so because the endotoxins and exotoxins, they're going to react differently, but you're still going to get pretty much the same effect on what it does for an inflammatory process in your body. It's going to excite those inflammatory cytokines, which is going to cause a reaction. So I don't care which one it is. Let's find out which one it is.
Mhm.
And but for me, I'm still seeing more that it's more mycotoxins than it is these endotoxins. That's just in my practice.
And I
That's just
think
what I'm seeing.
you're not the first person I've asked that question to, and I think the majority of healthcare providers that we do work for, it winds up being mycotoxins as well. The thought process is that there's so much, I guess, toxicity that our bodies can handle, and then once we kind of hit that tipping point, then all of a sudden that's when the wheels fall off, right? When the body's like, okay, fight or flight, no more.
Not
It's just
gonna
too much.
Yeah, you're right.
Yeah.
Just, you can only your body's only gonna tolerate so much, and, but, and I've had some people, uh, they come to me, they've already been to several other physicians, and they say, "Oh, I have an endotoxin, and it's from, whatever bacteria it was," and they'll say whatever one, and I'm going like, "Are you sure? Because it doesn't seem like that to me." And then I'll really do the due diligence and look a little bit farther, and they do have mycotoxins, and it was really mycotoxins all along. So that's why I still think it's more mycotoxins than it is these endotoxins.
That's the low-hanging fruit.
Yeah.
Yeah. It's, we both been doing this, well, you a lot longer than I have. We're going on 20 years. You're entering into, I guess you've already done 3 decades. So you don't look it. Yeah, that's the great thing. But there's been so much advancement. And that's one thing that really is exciting to me. We talk about all these different tests and diagnostic tools that we have that we didn't have before.
Oh,
There are
yeah.
actually, you mentioned there's 3 labs that do clinical or, mycotoxin testing on the person. There are now, I know, 3 labs that do environmental mycotoxin testing as well. So that'll help drive the pricing down a little bit as there's more competition, which is a great thing.
That's what
But
we need.
no doubt. No doubt. That way we have good information, right? So people can
Yeah,
make good data-driven decisions based on facts and not just, fear. But the industry has advanced, I think, on the medical side and the environmental side. I think about the progress in mold. Years ago, Lyme. We're a big sponsor of iLads every year. I think they're in London right now as we speak. I wish I could be
just
there,
came
but
back. I just spoke with them today. They just came back.
with them.
Yeah.
But I think mold is somewhat similar because years ago, Lyme disease was almost a pariah. It was dismissed or misdiagnosed, and everybody was told it's all in your head. Do you kind of see a correlation? That's where mold is today, mold illness?
I unfortunately I'm still seeing that somewhat. It's more recognized now than what it was 5 to 7 years ago. So I'm glad that it's more recognized now, but they are still being told it's all in your head. And I always I'm sad when I get those referrals or those people that have come to me and they said, "Well, I went to whatever university." and or you can name them all. And they said, well, they thought that maybe I had a psychological illness because they can't find anything.
Uh,
And but they don't believe in doing the urine tests to look for mycotoxins or to look for any other any other mechanisms that can be causing their issue. And because they don't really do that, they aren't really doing their due diligence to look at everything, but it's not approved by university settings, right?
mhm.
So some of those labs are still not, they still question them.
Yeah, progress has been made, but I look forward. I can't wait for the next 10 years and see how much further on down the path we are, at that point. I I guarantee you there's someone listening today that, has said, "You know what? I have anxiety or I have brain fog, or, I just don't feel well, this kinda general malaise." If you could give them some advice or recommendation, because it's so overwhelming, and oftentimes there's a spouse that says, "Hey, I don't believe you. I'm fine. It's all in your head." What advice can you give them? What kind of reasonable steps should they take?
So that's kind of funny that you said that because that was my patient this morning. Uh, the spouse didn't believe them. They said the spouse says, "I'm fine, I'm fine, I'm fine," but the one that I was on the consult with was not fine, and you knew they weren't fine because they were missing words, they were having issues, they were having rashes on their body, they were having a lot of detrimental things. So number one is get out of the living environment that you're in. That's the number one thing. You've got to get out of that living environment. You have to be in a clean space. And I can't reiterate that enough. You have to be in a clean space, number one. Number two is making sure of fiber, or, you can get, I use a lot of cholestyramine still, or well call, or, I have my patients that don't tolerate that. I have something that I call mycobind, which is actually an okra and a beet combined. They actually came up with that first in Europe, by the way. So they came up with that. Why? Because that was a gentle way to be able to pull these toxins and be able to get them out of your body. And also, the microbiome decreases the inflammatory response as well. So it decreases some of that inflammation. But you need to use antioxidants that are going to bring down some of that oxidative stress, because the longer you're exposed to all these things, you're going to have more oxidative stress in your body. So you have to take antioxidants. I don't care what kind, but you need antioxidants big time to start with. And then you need proper lipids, because phosphatidylcholine is really important in that process. And those things you can all get. We can go to the store, we can get a lot of these products, but I would start with that and then get the testing. Have your house tested, get your body tested. Those two things I think are key. And, if you don't have that done, and then you have to find somebody like you that's reputable, because there's too many people out here taking everybody's money. And well, because you've gone into some homes, I've told them, no, you need to go to this guy, and he's going to help you with your house because your house still isn't clean. And sure enough, you would go in, and whatever they did, they didn't do it correct, and they had a bunch of toxins still in their home. So, you know, but that's you gotta find somebody that's reputable to really help clean your home. That's not me because that's not my field, that's your field, and
Right.
I'll stick to mine. I'll help clean the person out. You clean the environment out, and I'll clean the person.
That actually was my call prior to this one, was, someone that's in, South Florida on the, East Coast, who had, a remediation company come in, and they cut out all the wet, damaged, drywall, which was great. That's part of the step,
Yeah.
but didn't do anything to remove the contaminants. And so she's been out of her house for 7 months now, and has, all these environmental toxins and still high counts of mold, because they actually didn't remove the contaminants. They just removed the building materials. So,
Oh my. Yeah,
yeah.
yeah, that's it. You gotta get it done right. Correct.
Yeah, 100%. Do you find, we hear this so much, someone will go to you as a patient. They're willing to run all the tests clinically to understand what's going on. Oftentimes, we see a hesitancy, and talking to a lot of our healthcare providers we do work for, is that there's a resistance to getting the home tested. There's a fear, perhaps. Do you ever see that and with any of your patients?
Oh,
And
yeah.
if so, what do you think that is, and how do you overcome it?
Well, they're afraid that they aren't going to be able to sell their home once they found out that they have mold in their home. So then they're afraid that they aren't going to be able to sell their home. That's it. Or they're afraid of the cost of the renovation to get rid of the mold. So they're afraid of those two things. They're afraid of the cost. They're afraid of those things. And but I always tell them your health is worth more than anything, and there's no cost to your health and to your life. And
Yeah.
you gotta be there, I have 6 kids, we have grandkids, you gotta be there for them, and I'm still young, I'm only 69, so I'm still young.
Yeah, there is and there's just a cost too of ongoing treatment, not feeling well, but supplements. And so, yeah, the ostrich approach really doesn't work very well. Get data, good
No.
data.
Yeah,
Uh,
get good data. And the
yeah,
problem is when they do that and then they don't get their house corrected, they get supplement fatigue, because you can only take these supplements for so long before you get fatigued on taking them time and time again, right? So,
yep.
nobody wants to take them forever. I sure don't. I have to have my supplement-free days, and, I'm not gonna do it, but, yeah, I take a lot, but I'm gonna take my supplement-free days because I live in a clean environment.
I need you to talk to Diane. She's got me, I think I'm on like 23 supplements a day. So I'm almost full by the time I take all my supplements. And it's like I've had a meal. I'm done. I'm good. So what or supplement fatigue. That makes
Yeah.
sense. I always try to leave with a message of hope because, again, this can be really overwhelming. I know you've had numerous patients that you've been able to walk through this journey. This is not a life sentence by any stretch of imagination. It doesn't have to be. Do you have any particular cases that you've or patients that you've taken that other medical providers have not been able to help, but you at the Crozier Clinic have been able to guide them through, and now they've recovered?
Yeah, I had, there's one, girl, she was pre-med, and, she didn't come from Florida, she came from a different state, because, yeah, as you know, a lot of my people don't come from here, they come from other places, and, but she came from another state, and she was a straight A student in pre-med, and all of a sudden, she had this intense burning all over her body, but the bigger problem is she couldn't read and she couldn't write.
Oh, wow.
She could read and write before, right? So now she can't read or write, and she has burning sensation all over her body, can hardly stand it. Was so incredible. And she came through. She had already been to, I forget, I think 10 or 12 physicians before,
Mm.
and a couple of them said that that's what they were qualified in. This is what they do. They do mold illness. They take care of people with mold illness. And she just wasn't getting anywhere. So she came in. She stayed here with us for, I think she was here for 3 months. And for her, I had to do more than just oral therapies. We did have to do some IV therapies. But you know what? She's finished her residency. So she was pre med. She got into medical school. She did her residency. And now she's doing a specialty residency. And, so she made it through. She could read and write. And I bawled my eyes out. When she
Yeah.
left, she wrote me a thank you note. And to have a written thank you note from somebody that couldn't read or write when they first came in, it meant the world to me. I gave
100%.
somebody their life back. So even though there's difficult cases in some people because they get so in their head that they don't really get the whole way well, because part of it's psychological too, right? Uh,
Mhm.
so that they don't really get the whole way well, right? But when they do, then you realize you did make an impact. And I have to remember those cases for all the more difficult cases, especially the ones that I have right now that are really difficult. And I'm like, oh my gosh, are we
Yeah.
going to get you there? And then I go back and I go, yeah, we are going to get you there because I remember I took other people through this.
It making a positive impact is what it's all about. And we all have those difficult days. I have some of the letters from some of our clients that we had somebody had MS that actually wasn't progressing, wasn't doing well. We came in and was able to treat her home. That testimony is on our website. If I ever have a rough day, I go back and read that because she says my clinical labs only got better after we addressed the toxins in my home. And
Mhm.
so if I ever have a day where it's like, man, I want to bang my head up against the wall or whatever, I go back and read that and say, okay, that's the purpose. That's what we're here for. So
Yeah,
yeah,
that's why we do what we do, right?
100%,
It's
100%.
difficult, but we do it.
No doubt. I'm sure there's going to be people that want to reach out and learn more. What's the best way of getting a hold of you or your clinic?
Well,
Phone number?
they can do crozierclinic.com. Our phone number here is 407 734 7668.
Very good. They can also go, we have you, you're one of our preferred providers. And so if you go to our provider network at themoldpros.com and click, they'll see your picture there, learn a little bit more about you. We'll have links there. They can go back and find you that way as well. So
Okay.
I really appreciate it. Thank you very much. It's
Thank
been
you.
great. It's been great having you. We got to do this again. I want to talk about peptides next time because that's the hot thing. So if you have
Yeah, we
another
can do
20,
that. Let's
yeah,
do it soon.
let's do it. All right. So as we close, listeners, remember this: mold recovery and environmental illness. It isn't just about fixing buildings. It's really about restoring lives. And at the Mold Pros, we're committed to helping both the environment and the individual because true healing requires both. Through our work and conversations on mold, mycotoxins, and more, we aim to bring clarity, expert insight, and real solution to those navigating mold exposure and recovery. So if you suspect mold or biotoxin exposure in your home or workplace, reach out to themoldpros.com. We're here to help. And if you found this episode helpful, make sure you follow us wherever you listen to your podcast. And if you know somebody struggling, share this with them. Maybe it can make an impact in their lives as well. So this has been John Bodie. Thanks for listening, and we'll see you on the next episode. You've been listening to Mold, Mycotoxins, and More with John Bodie. If you're ready to take the next step towards a healthier home, follow the show and visit themoldpros.com for your free consultation. Because clean air is the first step to true healing.